My name is Dr. Sylvia Rosas. I'm a nephrologist and the president of the National Kidney Foundation. I mostly do clinical research related to diabetic kidney disease, but I also am the director of the Latino Kidney Clinic at the Joslin Diabetes Center. Social determinants of health are the conditions in the environment where people live, work, educate, pray, that affect their health conditions. So these could be things like transportation, housing, access to healthcare, etc. So all of those conditions at the end affect our quality of life and our health. We know that Hispanic patients are less likely to be evaluated for a kidney transplant. They're less likely to receive a transplant from a living donor. Patients with kidney disease that are Hispanics frequently have language barriers. So that's one of the things that sometimes delays their referral. And then the evaluation also seems to take a little bit longer. So they're waitlisted a little bit less often than others. And in particular for the Hispanic population, there are some that are undocumented immigrants, and sometimes it's very hard for them, or if they're uninsured for any other reason, it's very hard for them to access the transplant system without insurance. So all of those things contribute for them to be less likely to be referred. And also you have to remember that when you undergo the evaluation process, it takes a long time to do that. And you have to take time off work. And if you're being employed by the hour, you may not have the time to go for a half-hour visit here and there, etc. They frequently also have transportation issues. That's why it's so important that centers are focused on trying to do multiple visits at the same time so that patients can really take off that day or that half day so that they can get all the procedures and visits done at the same time so that they can move further along on the transplant list or being evaluated and finally get on the list. The NKF has a lot of programs that I think are very helpful. If we're talking about transplant, the Big Ask Big Give is a fantastic program that teaches patients how to be social media savvy, put their stories out there, find a living donor. They have several programs on trying to help the patient understand what the journey is for transplant evaluation and how to get listed. There's the Peers program if you're a patient that's on dialysis or chronic kidney disease and you need help from a mentor, be a patient that has undergone the same journey that you're doing, sometimes speaking to somebody that is undergoing the same issues that you have undergone and has been successful is very helpful for that patient. So there's a lot of patient education that the NKF offers that the patients can take advantage of.